Hi there, this is Dr. Lieselette Schuster. I have another question for you. Did you know that chiropractic can help those with essential tremors? Actually, that's true. I have a few cases that I'd like to talk to you about. And actually, this makes sense since chiropractic has a direct effect on the nervous system, and essential tremors are rhythmic nervous system disorder. This disorder causes rhythmic shaking but is not related to Parkinson's. The shaking occurs with tasks such as tying shoelaces, writing, shaving, holding a utensil to eat, or holding a cup to drink. This shaking can also affect household and work-related activities. According to the Mayo Clinic, symptoms may be aggravated by stress, fatigue, caffeine, and temperature changes. So here are some cases of how chiropractic has helped those with essential tremors. According to a clinical case in the United States National Library of Medicine, a 39-year-old woman presented with essential tremors and migraine headaches that occurred 2 to 3 times per week. Her essential tremors were diagnosed in 2000, and her migraine headaches were diagnosed when she was 10. Both diagnoses were made by her general medical practitioner, and treatments included prescription medications and over-the-counter pain relievers. During the chiropractic exam, structural shifts were found in the patient's upper neck called vertebral subluxations. Subluxations have a direct effect on the nervous system, which can cause a plethora of symptoms, not just pain. Because of these findings, the patient received chiropractic care of the subluxations in her upper neck. This had an immediate response as there was improvement in her tremors and migraine headaches following her initial chiropractic treatment. There was also a sustained improvement after 4 months of care. I think this immediate response is quite promising, don't you? Another case of essential tremors was reported in the journal Annals of Vertebral Subluxation Research. A 38-year-old man had been diagnosed by his medical doctor with essential tremors in his head and arms for 15 years. The man described his head and right arm tremors as being a 10, the worst on a scale of 0 to 10. His tremors occurred daily and lasted the entire day. He was unable to write with his right hand, unable to lift a drink to his mouth without spilling it everywhere, and all of his activities of daily living were interrupted by the tremors. The patient underwent a chiropractic examination, thermal heat studies of the spine, spinal x-rays, and motion x-rays. The results verify the presence of subluxations in the upper back and neck of the man's spine. The course of care was started, and after the first adjustment, the man noticed an improvement in his symptoms. He reported that he was able to lift his right hand to his mouth with minimal tremors. And as care continued, he reported improvements of 75% for the tremors in both of his arms, 99% for the tremors in his head, 90% for his low back pain, 90% in overall stiffness, and he felt that his overall quality of life had improved by 60%. This means that there was a lot less stress on the nervous system, which created more calmness and a lot less shaking. Pretty cool. Essential tremors can also occur in children, and this was the case in the Journal of Pediatric, Maternal, and Family Health Chiropractic. They reported a clinical case of a 20-month-old male with tremors in his right arm and hand. He also stood with his legs extremely wide apart, and he had speech delay. The chiropractic exam included thermal readings of the spine that indicated the autonomic nervous system was not working properly. A chiropractic exam of the spine revealed subluxations of multiple vertebrae. The child was treated with a gentle adjusting instrument and also given cross-crawl at-home exercises as part of his treatment plan. After 2 months of care, the re-exam showed improvements in the autonomic nervous system with the thermal scan. The frequency of his intention tremors significantly decreased. His verbal communication skills improved, and his parents reported a marked improvement in their son's overall quality of life. I think that must have been such a gift for the parents to see such a positive change in their child's symptoms. So, essential tremors are just another example of how chiropractic is not about treating the condition. It's about balancing the nervous system. Your body works in a very sophisticated way and relies heavily on optimal communication between the brain, the body, the cells, the nerves, the immune system, hormones, chemicals, and everything else that we are made of. This communication is what allows the body to continuously heal itself from the inside out. And this can occur more easily when the nervous system, body chemistry, emotions, and other imbalances are addressed and alleviated. So consider surrounding yourself with a multitude of health providers that help balance all of these parts within yourself to live more optimally. I hope you enjoyed today's video about essential tremors and how chiropractic can be helpful. Until next time, I'm Dr. Lisa Schuster.